40. What are the adverse reactions that the patient should report to the PHCP? The answer is, the adverse reactions that the patient should report are skin rashes, pruritus. Pruritus is itching, urticaria. Urticaria is hives, severe diarrhea and fever. 41. How are the cephalosporins like the penicillins? The cephalosporins are like the penicillins because they are both bactericidal. If allergic to penicillin, then most likely allergic to cephalosporins. 42. Which diseases are the cephalosporins used to treat? The answer is, the diseases the cephalosporins are used to treat are lower respiratory infections, otitis media tonsillitis, septicemia gonorrhea, UTI staph infection, and strep throat. 43. Are the cephalosporins bacteriostatic or bactericidal? The answer is, the cephalosporins are bactericidal. They kill bacteria. 44. Many of the adverse reactions of the cephalosporins are like the penicillins. So, what is the name and the symptoms of a potentially life-threatening adverse reaction associated with cephalosporins that is also common to the sulfonamides? The answer is, the name and the symptoms of a potentially life-threatening adverse reaction associated with cephalosporins that is also common to the sulfonamides is the Stevens-Johnson syndrome. The symptoms are fever, skin lesions, and cough. 45. What assessments are necessary to make prior to administering a cephalosporin? The answer is, the assessments that are necessary to make prior to administering a cephalosporin are history of general health, allergies, current symptoms of infection, and vitals every 4 hours. 46. What should the patient be warned in regard to drinking alcohol when taking a cephalosporin? The answer is, the patient should avoid drinking when taking meds and for 3 days after completing the course of therapy. This is due to a severe reaction similar to disulfiram. It blocks enzymes that process alcohol. This causes ethanol sensitivity, NV, dizziness, flushing when alcohol is consumed. 47. How should an oral dose of cephalosporin be administered with regard to food? The answer is, the way an oral dose of cephalosporin should be administered with regard to food is to take with food or milk to reduce GI upset. 48. What intervention should be taken when a client has NV associated with oral intake of cephalosporins? The answer is, the intervention that should be taken when a client has NV associated with oral intake of cephalosporins is to take medication with food or full glass of water. 49. When administering oral cephalosporin suspensions, what should the PT do? The answer is, when administering oral cephalosporin suspensions, what the SciTech should do is shake the suspension well and refrigerate for 14 days. 50. When administering parenteral injections to an elderly patient, what should the PT assess and what are some considerations when planning and implementing treatment? The answer is, when administering parenteral injections to an elderly patient, the SciTech assesses the muscle for atrophy, for loss of muscle mass. Some considerations when planning and implementing treatment is to rotate injection sites, and maybe using a different angle like 45 instead of 90 degrees.